Exercising is really important if you have a thyroid disorder. But do you know what is the right kind of exercise that you need to do to get the maximum benefit? This is what I'm going to talk about today. Hi, I'm Dr. Anshul Gupta. I help people reverse their thyroid diseases by making personalized functional medicine plans. So everybody knows that exercise is good for them. But if you do have a thyroid disorders, you have to be careful with what kind of exercising you are doing and how you are starting an exercise program. Research has shown that not all exercising is good for thyroid patients, and several of my clients, I have seen that their health has gotten worse because they were doing the wrong exercise or they started the wrong exercise program for them. But first, let's see what are the benefits of exercising, especially if you do have a thyroid disorder. The very first benefit that exercise provides for thyroid patients is that it helps them with weight loss. Several people with thyroid disorders continue to suffer from weight gain issues or are not able to lose weight. And exercising, especially the right kind of exercising, can be very helpful for them to lose this extra weight. The second benefit of exercising is that it helps with mood changes. Several people with thyroid disorders suffer from depression, anxiety, or they have this roller coaster ride of one day feeling good, the next day feeling depressed, the third day feeling anxious. And exercising by rebalancing your hormones, especially the thyroid hormones, it actually will help you with your mood changes. The third benefit of exercising is that it will keep you regular in terms of your bowel movements. If you're having constipation issues, if you're having bloating issues, exercising will help you with regular bowel movements, as well as exercising will also help reduce the bloating that you are going through. The last benefit of exercising is that it keeps your brain in good shape. Again, brain fog is a very common symptom that a lot of thyroid patients go through. They are not able to pay attention or they are losing their memory. And exercising has helped, especially in increasing the BDNF chemical in your brain, which again improves your memory function as well as your attention span. So you see, exercising has so many benefits that each and every thyroid patient can avail. And the important part is that doing the right kind of exercising. Now let's talk about what are the different kinds of exercising that is available and that you can do. The first kind of exercising is the most common one, which is the aerobic exercising, which is basically doing either jogging, running, using an elliptical or walking. So this is what we call as a cardio exercising that a lot of people do in different fashions. The second kind of exercising is strength training. The strength training is where you're lifting weights. That doesn't necessarily mean that you are lifting very, very heavy weights where you are becoming a bodybuilder, but it is mainly are any kind of weights that you're lifting to keep your body in good shape as well as your muscles. The third kind of exercising is high intensity training, which we also call as HIIT training. HIIT training has become really popular in the recent past, especially people who are going to Orange Theory or people are going to different kinds of gyms, then that they're doing this HIIT training. So these are the several kinds of exercising. Now, what is the best exercise that research shows? So research shows that a combination of aerobic, which is a cardio exercising with strength training, is the right kind of exercise for thyroid patients. HIIT training, especially high interval training, has not shown to be the best for the thyroid patients. The reason being, HIIT training puts a lot of pressure on your body. And it has shown that the thyroid patients cannot take so much of the pressure. And a lot of times their thyroid levels will fluctuate during this time. And it also affects different kinds of other hormones too. And that's the reason a lot of times we see the inflammatory markers going slightly higher in HIIT training patients, especially if they do have a thyroid disorder. Now, that being said, if you are an athlete or if you have been exercising for a long amount of time for several years and you have been doing HIIT training, your body might be accustomed to it, then it will be fine. But if you are a patient who are starting with exercise training just now, then the HIIT training is definitely not a good choice for you. Especially also in the cardio training, I would like you to start very slow. Several of the clients that come to see me, they've started a cardio regimen which was too much for them and it was too overwhelming. Now, the thyroid patients are very, very fragile. They have a very narrow window of exercising which their body can tolerate. So it is very important to work with your body. Now, if you're that person who has not been very physically active and you want to start being physically active, then the best way for you to start maybe some very mild walking or jogging or elliptical is another option that you can start off with. And then once your body get used to it, then slowly and slowly you can incorporate strength training. Start with very minimal amount of weights, maybe 5 pounds or 10 pounds is a good way to start off with. And then you can increase slowly as your body tolerates and as your muscle tolerates. But when you're combining the cardio training with strength training, it gives you benefit of not only improving your stamina, but also improves your muscle health. And by improving your muscle health, actually a lot of times we do see a greater weight loss in thyroid patients. And also the strength training and the cardio training combined together gives you all the benefits, of losing weight, improving your gut health, improving your brain health, improving your mood, rebalancing your hormones. All of those things are achieved if you're combining the cardio with the strength training. Now, again, as I reiterated before, it is very important that you start slow with any kind of exercising that you are going to do and then build it up slowly as per your body needs. So don't go out, to the gym tomorrow itself and then, like start running like 4 or 5 miles, on the treadmill or anything. That is going to be too much for your body. The second thing is that, if you do have joint pains or muscle pains, then maybe you can start with low impact exercising like water based exercising, like doing swimming or walking in water or in a pool. So those are good ways to kind of again give rest to the joints and also see the benefits, of other exercising that way. So water based exercising is a good way to start, especially if you have joint issues ongoing. So you see, exercising is wonderful for each and every thyroid patients. I will definitely recommend doing that, but start slow and then go from there and incorporate both cardio and strength training into it. I hope you enjoy this video. Please like and subscribe to the channel. Thank you so much. Bye-bye.